demonstration. Okay? So you're going to enter the room. Knock, 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 knock. Good morning. My name is Dee Dee. I'm going to be your nurse today. I'm going to go ahead and do your head-to-toe assessment. Could I have your name, please? James Butts. And your date of birth? 12/31/69. As you enter the room, you're going to go ahead and look what's attached to your patient. I see that he has oxygen on 2 liters. Then we go ahead and look if there's any IV tubing or IV bag to make sure that the bag is him, has the label for the patient's name, what the pump is set at. If he has a catheter, you'd go ahead and look at the color of the urine, and to make sure that there's urine in there, the color, if there's anything, sediment, the characteristics of the urine. Then you're going to go ahead and ask, Mr. Butts, do you know where you are? He's going to tell you that it's the hospital or the long-term care facility. And then you're going to ask, do you know who you are? His name is James Butts. He's going to go ahead and tell you that. Then he'll tell you the time and the date, and then the situation. What brings you here to the hospital? And then he'll tell you the reason, his chief complaint. And then you go ahead and start with your pen light. You go ahead and close the curtain, providing privacy. And then you, of course, washed your hands once you entered the room. Then you have the patient look straight ahead, either at your nose or straight ahead on a picture across the wall. You're going to go ahead and bring your pen light in, check the pupil reaction. You're going to go ahead and come around, check in the pupil reaction, and come back. Go ahead and look in his mouth for any mucous membranes. Look at his nose, checking his ears, making sure there's no drainage. And then you go ahead and start with your stethoscope. You listen for a full minute on an apical pulse. It's 5th intercostal space, mid-clavicular line. You go ahead and hold and listen for a full minute with your apical pulse. So let's say the minute's up. You've already counted, and that gives you your heart rate apical. Then you go ahead and listen to lung sounds. There is your anterior lung sounds and then posterior. So you go ahead and have the patient take a big deep breath in through the nose and out through the mouth. In through your nose, out through your mouth. Go ahead and do it over here. There's also lateral lung sounds, which are 3 finger spaces away from their axillary area. Then you go ahead and have them take a big deep breath in and exhale. Big deep breath in and exhale. If the patient at this time is ambulatory, you can have them sit up. Or if they're not ambulatory and they're in complete bed rest, you would go ahead and finish your anterior part of your assessment and then roll them, which we will, because this patient is not ambulatory at this time. Since you still have your stethoscope, you would go ahead and listen to bowel sounds. You follow the track of the stool that travels. So you start lower, left lower. You listen, right lower. Right lower. And then you listen for, until you hear something. If you don't hear anything, you have to listen in each quadrant for full 5 minutes. So gurgle, 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 gurgle. And then you go, is there any pain? Is there any pain? Is there any pain? Is there any pain? While you still have your stethoscope, you can go ahead and check skin assessment, making sure there's no bruising, skin tears on both sides. Then you want to check to make sure that the radial pulses are equal. You go ahead and just check. You don't have to count. Then you'll do cap refill. Push the nail bed or the fingertips to see if it returns in less than 3 seconds. Look at the same side. You check the radial pulse. You check the cap refill. If they have an IV site, you want to check to make sure there's no redness, no swelling, if there's no pain when you palpate. And then to finish the neuro check, you would go ahead and have the patient squeeze, squeeze, squeeze as hard as they can with your hands, and then go ahead and release. Now that's a good time, once you check circulation, to go ahead and check a blood pressure at that time if you need to, okay? And then, when you're done with that part, you go ahead and, if the patient is not ambulatory, this would be a good time to check the peritoneal area. And we checked, and the patient has no stool or urine at this time. Then you uncover your patient. You want to check the lower extremities at the same time. So you want to look from the knee, mid-thigh down, and you're going to check edema. You want to take 2 fingers and palpate across the shin to make sure there's no indenture of your fingers. And then you're going to check the DP or dorsopedialis, and then you want to check the post-tibial on both. You're not counting, you're just making sure that they're equal, okay? Then you can do the cap refill on the toes, return in less than 3 seconds also. Then you want to finish your neuro check by having them pull them towards you and then having them push down as hard as they can like a gas pedal or a brake pedal. Okay? Then once we're done with that, we would go ahead and have the patient roll to the side. At this time then, you would go ahead and check the back of their head, skin assessment wise, making sure there's nothing wrong with the coccyx moving down the leg. And then you would take your stethoscope and you're going to check different 8 places posteriorly. So you have the patient take a big deep breath in through their nose and out through their mouth. You do it in a zigzag formation, having them take an inhale through their nose and exhale through their mouth, all the way done. And then once they're finished, you go ahead and get them comfortable. Cover them up. Make sure you provide the call light. The bed then is lowered and locked. Your side rails up ×2. And then also at that time too, you may ask if there's any pain. When you walked into the room, does the patient have any pain on a scale from 0 to 10? If they do, then you have the acronym WILDA, words to describe if there's any aching, shooting, stabbing. The intensity would be the 0 to 10 scale. The location, where's the pain at? The duration is how long it's lasted. Has it been constant or intermittent? And then A is aggravating or alleviating factors. Anything that makes it worse or anything that makes it better. But you always conclude your head-to-toe assessment with safety. All right, and this concludes the head-to-toe assessment.